Hi, this is Dr. Grace Chen. I'm a licensed marriage and family therapist and MGR approved consultant. In the past 2 years, I have facilitated 85 EMDR basic training consultation groups and over 50 EMDR certification groups. So I conducted a qualitative research using my own EMDR basic training consultation group notes and identified the 10 most frequently asked questions from my consultees. This series of short videos are designed for the beginning EMDR learners who start out to incorporate EMDR into their clinical practice. Clinicians often feel an EMDR funk or a lack of confidence in guiding their long-term talk therapy client into the structured EMDR protocol. The seventh most commonly asked question is, how can I take my long-term talk therapy clients to go move beyond resourcing and go into the phase 4 to 7 reprocessing? Or sometimes the question is communicated as, how can I take my long-term talk therapy client to transition them into the EMDR, that very phase structured protocol? There seems to be a myth or belief that talk therapy is bad and EMDR bilateral stimulation is good. Therefore, if I'm not actively doing bilateral stimulation, it means that I'm doing bad EMDR therapy. The truth is that talk therapy and bilateral stimulation reprocessing are part of the EMDR protocol. We have 8 phases protocol. And when you think about that, in these 8 phases, phase 1, 2, and 8 has a lot of talk therapy in the process. If you are struggling to transition your client from talk therapy to EMDR phases, my trick is to start with phase A re-evaluation. Well, you can start your session by asking your client, hey, how did it go? How did they do after the session last time? Do they experience any dreams, thoughts, emotions, or memories? Any changes in their symptoms, relationships, or life circumstances? By doing so, you can connect your client back to the ending of your last session or connecting the client to what you talked about and what you discussed last session. And then start to transition your client from talk therapy that talk more about the crisis of the week to connect them to the work that you do last week. It is common and it is also acceptable to have talk therapy sessions in between the active EMDR reprocessing session. In the other video, I have highlighted that at times phase A might run very long and therefore you don't have time to engage or go back to the reprocessing again. And that's totally understandable. However, when the client brought up the different issues during the week, you can just try to pay close attention to whether the topics or the issues that client brought up, is it because they're connecting to the original target memory as part of the maladaptive memory network? And if that's the case, at the end of the session, you can invite the client to go back to the target memory because the crisis of the week is part of the maladaptive memory network of the target memory. So if we can desensitize reprocessing the target memory, then the crisis of the week may not be the crisis again. At the same time, if the client really resists returning to the processing, then just say, I just prefer to just talk. Don't let the client stop you. Try to explore what's the underlying reasons that client doesn't want to go back to the reprocessing. Therefore, often at times, the barrier in transitioning from talk therapy to the much more structured EMDR phases protocol is that the clinician themselves might be the barrier. A lot of times, the clinician prefer to use their familiar talk therapy interventions because it gives them an ability or time to rescue their client. At the same time, seeing the client go through a reprocessing and feeling their feelings to heal their trauma, it's very unbearable or difficult for the therapist to hold the space. Therefore, if a client or you have difficulty in transition, it's really not a bad idea to really examine yourself and consider maybe there's a barrier there because client suffering or the difficulty might activating your own maladaptive memory network that preventing you from transitioning the client. If you want to learn more about developing the elevator pitch, so you can use the elevator pitch to transition and inviting your client back to the reprocessing because the crisis for the week is relating to the target memory. You can click on the link below and it will take you to the EMDR elevator pitch short video.